The focus of Governor Phil Scott's State of the State address was a workforce shortage hitting many industries. One area particularly hard hit is the state's healthcare system. State House reporter Devin Bates joins us now live in the studio to explain the strategies lawmakers are considering here to bring in some much needed relief. Devin?
That's right, Lauren. This particular effort to boost Vermont's healthcare workforce dates back to January 2020, 2 months before the pandemic arrived. The impact of COVID has only made the problem worse, and lawmakers say vastly more complicated. Across the country, the healthcare workforce is one of many industries facing what's been dubbed the Great Resignation. Prompted by the pandemic, people are quitting their jobs in record numbers. In past recessions, the health sector was able to weather through, even seeing job growth.
Healthcare workers, people in the system are burnt out.
State Rep Mary Cordes sits on the House Healthcare Committee and was also a founding organizer of the Vermont Federation of Nurses and Health Professionals. Her committee reviewed a report on possible workforce strategies like investing more money in scholarships or doing more to promote careers in healthcare. Given what she's seen the past year, Cordes doesn't feel it's quite enough.
The kind of work that we're doing and the intensity of the work that we're doing is not, we're not going to be able to recruit more people and retain people by offering tax incentives.
The suggestions came from an advisory group that included mental health professionals, physicians, and the Green Mountain Care Board. It was chaired by Ina Backus, the Director of Healthcare Reform at the Agency of Human Services.
As we think about strategies and how Vermont can be competitive in a fiercely competitive environment, one of the things that stands out is Vermont's vaccination rate.
Representative Emma Mulvaney-Stanek noted there's a lot of focus on recruiting, but retaining current healthcare workers is just as vital.
A lot of both what we heard in the State of State yesterday and even in this this plan focuses a lot about bringing new people in. And we have a lot of Vermonters here. I'm curious if we can learn more about how to retain people in these fields, because when I see folks working in the healthcare world here in the state, I'm wondering about livability of these jobs.
Now, in order to maintain Vermonters' access to health services, providers have also relied increasingly on traveling nurses. These hires have increased 26% in a year, and the cost for Vermont hospitals rose from $50 million to $75 million. Shifting gears to something else that happened within the legislature today, an update on Vermont courthouses that have struggled to bring cases to trial due to COVID restrictions. In September, we told you about the frustrations of Grand Isle State's Attorney Doug DeSabato over limited hours at the county's only courthouse. It was operating just 2 days a week, and now DeSabato is saying the situation has gotten worse. He's imploring lawmakers to do something.
Since the restructuring of the Vermont judiciary, there's been this intentional erosion of our staff here, senators. And we have one full-time person now. That's it. And it's become extremely overwhelming for this one person. More than once, she's been found in tears.
I should also mention, DeSabato said in some remote trials, people don't have access to video equipment, so they are calling in, and he said that makes it much more difficult to do his job. Once again, imploring lawmakers to take action and help Vermont's courthouses. Live in the studio tonight, Devin Bates, Local 22 News.